My name is Dr. Ben MacQueen. I'm with Desert Bone and Joint Surgeons, and today I wanted to talk about athletic injuries in children. Studies show that 1 in 3 children who participate in athletic events will sustain some type of injury that's serious enough to prevent them from continuing practice or participating in games. Many of these injuries can have lifelong consequences as well. Also, many of these injuries can be prevented through some simple safety guidelines. Here at Desert Bone and Joint, our goal is to provide education and increased awareness about some of these safety guidelines that can prevent these common injuries. Some of the most common injuries that we see are sprains and strains, and these include typically ankle sprains or knee sprains. Other injuries are more overuse type injuries. For instance, if your child is involved in baseball, oftentimes there can be injuries to or pain in the shoulder and the elbow based on too many pitches or pitching for too long during the season. Other injuries can be if your child is involved in running sports. Shin splints can be a problem, or ankle pain can develop from, again, overuse activities. Perhaps the most debilitating and concerning of these injuries would be fractures. And many times we see this simply on the school playground with the monkey bars or perhaps on a trampoline. And these involve the wrist and the ankle most commonly. There are some simple safety guidelines and keys that we can follow to help prevent many of these injuries. And number one is to have your child refrain from any activities involved in their sport for at least 1 or 2 days a week. Now, this is important for physical recovery as well as mental recovery, as your child can maintain their motivation and be refreshed for the upcoming week. Secondly, it's important to take at least 2 to 3 months off during the year from any particular sport. For instance, if your child's involved in traveling sports with soccer or baseball, these can provide opportunities for your child to play year-round. Well, the problem with this is that sometimes if playing year-round, your child can develop overuse pain, stress fractures about the shoulder in particular, or elbow pain, as well as knee and foot pain as well. Finally, it's important to have the appropriate safety gear and supervision during particular activities. For instance, if skateboarding is your child's sport of choice, it's important to wear a helmet and to have the appropriate elbow and knee pads. Again, if they're on the playground, they should have the appropriate supervision and limit the number of participants on the equipment at one time. And if you have a trampoline in your backyard, it is important to limit the time that your child spends on the trampoline and the number of people on the trampoline at one time. For other safety tips and guidelines, please visit us on our website at www.desertboneandjoint.com, and you can also connect with us on Facebook. Thank you.